Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
A dental hygienist
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. I've been doing these Lumineers now for over 20 years. I've never given a patient a shot, and I use sensitive tooth structure as a guide to when I should stop. Now that means that when we're doing these procedures, there's never any preoperative, postoperative sensitivity. If you ever have a patient that's dissatisfied, you can always remove it. And so today, as we go through this process, there's some of the things that are very important. You need to be prepared. Now, something else that's extremely important is you see I'm wearing Magnification. And in my hand I have the Lumineer Magnification system. This will give you the ability to see visually about 4 inches from the surface that you're working on. That means that because you can distinguish between sensitive tooth structure and non-sensitive tooth structure, between porcelain, between ultrabond, visually, that you will be able to work on your patients without hurting them, and they won't have to be numb. With that, we're going to get started with surface preparation. This is the most difficult part of it when I place the mouth guard in. Okay. First thing I like to use is etch and seal. Etch and seal is 18% phosphoric acid with aluminum oxalate. And the purpose of the aluminum oxalate is I can place it on dentin, and the oxalate will seal the dentinal tubule. So we have 2 good things happening at once. Etching the enamel, and I place a little in the middle of each one. Then I like to put that little dab on, and then I brush it, so I just cover the surface of the tooth, and I don't have to rely so much on a syringe to place it. It's very simple, but you're going to see what a difference this is going to make without having to make temporaries, without having to cut the teeth down. And now we're going to put tenure AB on the surface. With the tenure bonding system, it's not light dependent. It will bond with any material, and we've been using it for a long time, and all I can tell you is that it always works, and it'll always work with any brand of composite that you happen to be using. Now what we're going to do is use the try-in paste, and we're going to put it on the right central, and we're not going to put it on the left central. There's nothing wrong with mixing a little opaquer with your shades if you want to or need to. I generally try not to try all the veneers in on a patient. There's a tendency to let everybody take a look at their veneers like they were trying on a suit of clothes. Okay. Now you see the transformation that's taking place. Okay, now I want to show you what happens when we don't put anything on the tooth for the try-in. Notice how much more opaque white that is. So if you want to find out what the shade is really going to be, then you want to always have a medium between the porcelain and the tooth. Because when the light is refracted through a surface, it continues on until it runs into a different index of refraction, such as air has a much different index of refraction than does the tooth or resin or porcelain. And so we've decided to stay with that shade. Now once you put the tenure S on, these things start setting pretty fast. Tenure S is a bond enhancer, so we use that to clean the try-in paste out of the veneer. And if we don't get all the try-in paste out of the veneer, it's really no problem. And the reason is because Tenure S is what we use to remove it, and it will cause the try-in paste to polymerize. And you have to be very sure that you get the right teeth in the right order because they pretty much look alike. And I don't necessarily have to seat these all the way. Why? Well, you and I worked with crowns and bridges, and we were taught to have good margins. Why did we want a good margin?
Right leg.
We wanted a good margin because we wanted a stress-resistant, non-micro-leaking restoration, and the cements we had to work with were pretty lousy. And the thing I think that surprises so many people is lab technicians that have never worked with Serenade porcelain, people that have to compete with Serenade porcelain, suddenly are making razor-thin veneers and telling you how to be careful with speed bumps and all the things that won't work. And if these are done properly, they fit the tooth. And I have to tell you, they make me look good. At least I think they make me look good if I don't spoil it. And all my work is done for me. So all I have to do is have an understanding of the materials. And I'd like to have a little gauze to wipe this off. That's good. And I'm going to use something that really makes this simple. And I'm going to use the 2mm tip on the sapphire light. Now, this is going to be 1 second. Now close your eyes. And the 1 second is to hold it in place, secure it in the middle. Close your eyes. Closing your eyes is the best protection for protecting them. Close your eyes. And now I take a brush with a lot of Tenure S in it, and I wipe the margins. Now these are fixed in place or riveted in place with that 2mm tip for 1 second. And I can't tell you how simple and how rapidly these things go because I use the sapphire system. I'll let you take a look at the lingual side. And she has an orthodontic band on there, and I want to take a little more of this resin off. But the reason I can remove this now is because I have fixed the Lumineer in place with that 1 second exposure. I don't like the technique of waving a wand in front of all of the teeth and causing partial polymerization. And the reason I don't is once you start polymerization, you have to complete it, because if you don't, it doesn't go to the same degree of conversion as it does if you start it right away and go all the way to the end. And I take a little of this off because it's easier now than later. Now we're going to go back and begin to set this for 5 seconds. Close your eyes. And 5 seconds per tooth. We're going to do 7 teeth, but it's going to take me less than 60 seconds to set this on all the teeth. That's why I like the sapphire light. This is a critical period. You don't want things floating around or anything. And so here we are. We have now placed Lumineers, and now we'll begin to finish all 8 Lumineers. When I begin the finishing process, I like to use the Lumineer finishing instruments. There's nothing special about them. It's the ones I find I use all the time. And I like to begin by removing the excess composite or Ultrabond in between the teeth and at the gingival margin. I begin with the burr on the interproximal. Remember, I'm using 4-power magnification, no anesthetic, and usually there's no blood. What I'm doing right now is removing the Ultrabond from the embrasures, and I'm removing it at the gingiva. Now, some people that suddenly, for years, couldn't make a thin Lumineer, or a thin veneer, they still can't make a Lumineer unless it's made out of Serenade porcelain, say that you shouldn't trim the gingival margin, it'll crack. And with Serenade porcelain, it won't crack.
Because of the ability to
And it's because it's a solid fused mass, and we've been doing this for, like, as I say, years after years. And then they say, well, we can make them for you, but it's better if you prep the tooth. Well, let's think for a minute. Why do we prep teeth? Well, we prep teeth because we learn how to handle restorative materials. And you're all familiar with G.V. Black's rules, cavity preparation. And G.V. Black took a real lousy material, amalgam, and taught it how to make a very practical restorative system out of it. And he did that by teaching us how to remove tooth structure in such a way that the tooth wouldn't break and the amalgam would have enough mass and strength so it wouldn't fail. And they'd stay in the patient's mouth for 5 or 10 years. But today, we don't have to remove sensitive tooth structure to accomplish what we are here now. If this were traditional veneers, you would have told the patient you'd make temporaries, there'd be anesthetic, and there would be sensitivity, at the very least. And besides that, sometimes there's sensitivity afterwards. So we like to say that with Lumineers, if you don't have to remove sensitive tooth structure, and you can restore the tooth without going through that process, then you won't have any sensitivity before, during, or after. You can take almost any shade and mask it with Lumineers if you have the shade modification kit. Many times if you have a thick veneer and the shade doesn't match, you send it back and ask to have it changed. If you have a Lumineer, you can put the shade modification resins under it and change the shade generally right at the chair. It's a little difficult to make a dark Lumineer lighter. So I always like to order them on the lighter side, and if I want to make them darker, I can. Now I'm going to start with the Sure 349. I opened some of the interproximal embrasures, and what we're doing here, and your hygienist could do this, or an RDA could do this if they have gentle hands, I'm just removing the Ultrabond from the glazed surface. Now the secret here is don't scratch the surface. And if you use the Sure 349, it's an orthodontic scaling instrument, band seating instrument. And you can see how, if you look at this one, I haven't gotten to it yet, and this one I have, we don't interrupt the glaze. Now you can always put the glaze back, but that's more work than I like to do, so it's a lot less work not to remove the glaze. See how easy that peels off? Now let's assume you didn't do this. In about 1 week, all of this would flake off by itself. So I don't try to get it all finished on the day of placement. We like to have them looking nice and be 90% finished. And then we have the patient back in a week and get all the things that we didn't get. But we like to check that gingival margin. And with Serenade porcelain, you don't have to leave a speed bump. You just come in and just trim that off at a 45-degree angle. And you shouldn't have any trouble at all. Oh, I got some bleeding, but that was my Explorer. Did I hurt you?
No.
The right answer.
No.
The thing that's going to be your big challenge here now is getting people to believe you, because they know that as long as dentists have been doing dentistry, we have been destroying sensitive tooth structure and then replacing it, and that's painful and unpleasant. So I really like these clinicians that say, my patients will let me grind their teeth down, close, and they will once they sit in the chair. But there's 9 more patients that won't sit in the chair because they say, that sucker's going to talk me into cutting my teeth down. So you have to let your patients know how revolutionary this is. And if you don't, they'll think it's the same old snow job they've gotten from dentists before that said they wouldn't hurt them, and then they sort of made it unpleasant. Open. And we want to check the occlusion. Occlusion saves more, cases and ruins more cases, or malocclusion does. This is where we detect a little bit of ultrabond, and we have to be sure and very careful that we don't let the patients leave the office with traumatic occlusion. What I'd like to do now is take the football-shaped diamond. Now, anybody in the audience that does traditional veneers made this much of a change this simply? All we did is take an impression with the Lumineer impression material, and that's very important because some of the cases that I see where there's been mistakes is they've had drags. So we suggest before you send a case in that you pour the model, check the model, and make sure the margins are satisfactory. Now I'm blending the porcelain, the ultrabond, and the natural enamel and natural tooth structure all together. Now, if you have a patient that has a space between their teeth and they don't want a conventional fixed bridge, which I always recommend highly, we have a thing called a hugger bridge. And I won't be able to show it to you today, but a hugger bridge would be perfect for this space right in here. Just take an impression and bond it in. It's made out of True Vitality, and they're holding up extremely well. Close. Now grind your teeth, go forward. One of the things you should remember, open, close, grind around, open, wide. And I'm looking for prematurities. She's only occluding on her natural tooth structure. Okay, now we'll have a saw. This is called a seri saw. I like this because after we've removed almost all of the ultrabond that we don't need, then it's easier to open the contact. Now you say, how's he going to saw through that contact with that wire there? And the answer is I'm not. But I'm going to let the patient go home, and I'll have these half open, and what I didn't open, she will open. And then I'll let her regular dentist take that wire off and replace it. Now you see how this comes through okay? Because that's not one of the splinted teeth. So I saw halfway through, and then I rocked the other halfway through. We just go through like this. Now, I've had people say, why don't you use a shim? I've done shims. If you do a lot of shims, you add up a lot of shims, add up to maybe a 0.5 millimeter. And then you don't get the contacts that you'd like to have. And the reason I don't open them all on the placement visit is the patient's been sitting in the chair for an hour. Up till now, it hasn't been too bad. She's really pleased with the improved appearance. And I haven't really used a lot of force yet. But when you're opening these contacts, that's when you use pressure, not pain, but pressure. And so if she comes back on the second visit, most of the unopened contacts will open. If you try to splint teeth with bonded composites, not very well. So I let nature do half my work for me. And on the second visit, she's just real relaxed and rested. And then it's easy for me to open the remaining ones if there's any there. Now this looks like a seri saw, but it's not. It's safe-sided diamond, safe-sided diamond. What I use this for is like the orthodontist used it for, is to open the contacts. And if you want to, they use it to open embrasures and make the teeth narrower. This is a nice treatment modality for taking your orthodontic patients to half, 3/4 completion, and then finishing them off with Lumineers, because almost every orthodontic case has teeth that aren't the right shade, aren't the right shape, maybe they're not the right size. And by using the sander like this, you can get in there with your floss. So it's a simple way to finish an orthodontic case off. Treat it for 6 months, put Lumineers on, and you're way ahead of the game. Now I'd like to take my needle nose diamond for the interproximals. I think the thing you should be taking away from all of this is how beautiful the result is, what a transformation we made It took about a half hour to take her impressions and do a smile evaluation. And then everything else was done for me. The other thing is you won't get all the Ultrabond off in this visit. So I tell patients when you go home and you brush, you'll notice things flaking off of your teeth. How long will these last? Well, dental advisor, as I say, after 1 year found they didn't have any problems once they learned how to do the procedure. This is the porcelain polishing paste. And as I say, I like to use it before I etch, it gets all the plaque off. And I like to use it when I finish the patient because not only does it polish some of the surfaces that we've braided that you wouldn't see anyway, but I see them with 4 power. And then I can do this polishing right in here. And I tell patients in some of the contacts you won't be able to floss, but we'll take care of those on the next visit. So the next time you have a lab technician tell you that if you wanted to look aesthetic, doctor, you got to remove more tooth structures, say, no thanks, I'll just do Lumineers.
The procedure was easy. It was not uncomfortable at all. The procedure was great. It was easier than getting my teeth cleaned. It was great. These Lumineers are going to give me, so much more confidence to smile and just be proud of my teeth.